Welcome again to this introductory part. Let's look at the importance of radiography in anatomy. Now, if I tell you that in the past, the medical students studied anatomy on cadavers, meaning they had to cut through, dissect cadavers for them to learn anatomy. And that is what I first of all mentioned in the other video as exploratory surgery. And technology came in, which is radiography, to cancel that aspect of us always cutting through to learn. Even though you can have an in-depth and better understanding of anatomy unless you cut through. That's working on the cadaver. When you actually cut through, you get to see it with your physical eyes, and it's better when you see it with your physical eyes. Learning is in different ways, but learning on the cadaver is the best. I can tell you, learning anatomy on the cadaver is the best. But technology has made it possible for us to learn anatomy without cutting through the body by imaging the body, where we now have conventional radiography, that is X-ray, to be able to image the human body and see internal structures without actually cutting through. Secondly, we have ultrasonography, where we use high-frequency sound waves to also obtain internal images of the body. And thirdly, we have CT scan, that's computer tomography. In the past, it was called computerized tomographic scan, but now it is called computer tomography. Computer tomography is just an advanced technology of X-ray, where we have a ring of detectors on the other side and a tube on the other side, and we have a couch where you are being seated and sent into. Fourthly, we have magnetic resonance imaging. Now, with magnetic resonance imaging, it is also used to image internal organs, but it makes use of radio frequencies and magnetic fields. And we have magnetic fields that are even stronger, 3,000 to 60,000 of the Earth's magnetic field. So it is very important that these modalities came in place to see that we can image the body internally without actually dissecting. Now, with MRI, it makes use of the hydrogen molecules or hydrogen atoms within our body. We also have functional MRI. In functional MRI, we image moment-to-moment changes within a tissue. So for instance, if we are imaging the brain, then we assign a task to that person, and then we image using functional MRI, where we are able to see the moment-to-moment change within the brain tissue as the person focuses on the task. And secondly, further, we have PET, that's positron emission tomography. With positron emission tomography, you see that it helps us get to understand the metabolism of tissues, how metabolic activities are actually happening within tissue. So you see, with PET, we are actually diagnosing function. So all of these modalities that have come to play, mammography, all of this can help us see internal structures of organs without definitely cutting through or dissecting through. So we say a very big shout out to all the engineers that keep working to see that technology is evolving, to see that anatomy is best understood without harming a healthy human being. Looking at exploratory surgery, you see that it was really not easy. Cutting through a human being just to look, observe, and when you see a problem, you start planning on how to solve the problem. It's so risky, right? For example, let's take appendicitis. Imagine in those days, they have to cut through to check to see what is the problem, and then they see that it's appendicitis before they start seeing what next, what treatment to give. Are they cutting it out, or what are they doing? Has it already ruptured? All of that. But that you can see it with imaging. So that is the importance of imaging. Imaging is just the best in the medical field, and that is why it is called the eyes of medicine. Thank you.